Our final presenter is Jenny. Jenny Brooks, who has a background in data analytics, and she's been working hard behind the scenes, but also in putting together the session today. Thank you so much, Jenny. So she works in the team at HLP and leads on the population health management and personalised care work at HLP, and has been involved in working around in development and care coordinators, and also helping to put together the fantastic session today. So over to you, Jenny.
Thank you, Hina. Hi, everyone. Yeah, so as mentioned, it'll be recorded and shared after, but I'm just going to take you through now kind of where you can get started practically to kind of show you which tools and support is out there in different areas and bring that together so you can kind of follow up on some of the exciting ideas that we've been sharing during this meeting. So my number one kind of tip to first get started would be to join the future NHS areas. So Nick mentioned earlier the first one, the Population Health Management Academy, which has some amazing resources. I'll just quickly show you this. So there's so much stuff on here if you haven't accessed, starting with kind of what needs to be in place to look at population health and personalised care, how you can look at the needs of your population, what intervention works. There's also an area about getting started with some useful videos and things you can share with all your colleagues in primary care, and how it kind of fits specifically with primary care networks as well. There's also a few other areas that are useful. So there's the population and person insight area, which looks more at the data and shows you a dashboard, which is from a national team, which shows population health data that's available at PCN level. It shows how you can segment your population into gender, age, ethnicity, and different long-term conditions, as well as deprivation. So if you're finding it quite difficult to use local tools to identify this kind of stuff, there are national tools out there. You just need to access the right areas and perhaps get access to them. There's also the equality and health inequalities area, which highlights the core 20+5 guidance and how it links into the health inequalities agenda. And I've also put a few forums here which has had lots of discussion on it, which you can get involved in. There's also some specific resources looking at population health with social prescribing and personalised care. But as I put here, the link is often not that formalised. It's often spoken about in terms of population health, in terms of the interventions that can be used. They might use a social prescriber, a care coordinator, or a health and wellbeing coach, but it's not kind of formally linked. But I think that's going to start happening over the next few months. However, as a result of discussion on the two areas, there was the lunch and learn that was put on about a month or two ago, that shows some case studies that highlight the two areas together, and I'd recommend watching that back as well. At Healthy London Partnership, we're also developing a Tackling Health Inequalities toolkit, which highlights how the three roles can be used to tackle health inequalities and give some practical tips to PCNs on how they can start engaging with their communities and the voluntary sector to take these approaches forward. There's also a wealth of case studies that show how these approaches have been taken in the past. A lot do focus on the vaccine rollout and targeting specific groups who are affected by health inequalities. So I'd recommend looking through these as well. And then this is just, I've kind of put all the resources that I think are most useful in a structured way. So depending on where you're at the moment, if you're looking to just understand a bit more, or sharing with your colleagues or your personalised care R's roles to help them understand a bit more about what population health and health inequalities are, you can share these resources at the top. And then moving more into how you actually implement some of the tools, or some of the kind of looking at what approaches or infrastructure is required in place, then you would look more into the applying and tackling health inequalities sections. And it should really be at the top, but also looking at how to engage your community, work better in partnership, and really get started on these approaches as a whole as a whole community, not just the NHS, is kind of what lies behind it. And then building on kind of the knowledge and resources available, there's a lot of free e-learning training out there, which, I mean, I've gathered these from different research, but also what's been recommended from people working in PCNs, and also what has been undertaken by social prescribing link workers, care coordinators and health and wellbeing coaches themselves. So these are really useful to share with your colleagues. And also, which has been mentioned earlier, looking at health inequalities, population health and personalised care, how it fits together in some of the guidance coming out. So the personalised care DES spec and the health inequalities DES spec clearly give some actions that will happen over the next year, such as setting up a proactive social prescribing service, which a lot of the case studies I mentioned earlier highlight how this has been gone about in the past. And also assigning a health inequalities lead to work on this and coordinate the activities to understand who is at the brunt of health inequalities and how they perhaps could be targeted through a proactive service. And last but not least, there is a wealth of data sources, as I mentioned earlier. If you are looking to really get more into the nitty-gritty of what your population groups look like and how you might identify a target population, then this is a kind of directory of what's available nationally. And there's a couple of resources about what technical capabilities and infrastructure might support you looking into these in more detail. But yeah, I will share this after, and the top takeaways would just be to join the future NHS spaces, talk to people in your area, see what's happening already, communicate on the forums, and yeah,